I'm here for the E4C project, and the E4C project is an empowerment for change project that is being implemented in rural district by FAO, and then in Busia by Uganda. The same project is also implemented in Kenya by our other partners and LVCTI. The project is aimed at reducing the incidences of HIV and then gender-based violence in those respective communities.
We are doing this by empowering young women and girls to advocate on the key issues, including HIV services, teenage pregnancies, and reducing the impunities of gender-based violence in their communities. We realize that so many of these young women do not have the voices. So we're working closely with their peers, who we've called the champions. So these advocacy champions are going to be advocating, are going to be speaking out on behalf of these young people.
I'm 23 years old, working with Public Health Ambassadors Uganda as under Empowered for Change project as a youth advocacy champion in my community. Mainly what I've learned in the 5 days training is advocacy along issues affecting the youth, the young people in my community.
In the community where I come from, we have an alarming number of teenage pregnancies among young girls. So from the training, I've been able to learn how teenage pregnancy can be prevented among teenagers.
For the case of the support of the advocates, we might need to equip them with gadgets that will support them in data collection, and these include the tablets. These are used to collect data from the field, especially reporting these cases of gender-based violence and HIV, and any other incidents around that. So this data will help us, make decisions that are really informed and also collect the real evidence of what is happening in the community.
So the project is going to work closely with already existing structures like the CSOs in the communities that are implementing sexual reproductive health. We are going to work closely with the districts. We are going to work closely with the common people on the ground.
From what I have learned, I will make sure that I engage stakeholders in district dialogues, community dialogues, sub-county dialogues, to address issues concerning gender-based violence, HIV, and teenage pregnancy.
At the end of the day, as Empowered for Change, we are looking out for an empowered youth. We are looking out for a woman who will understand that it is okay not to allow to be violated by their husband, that it is okay for them to go to the health facilities and access these services. It is true some of these services are available, but the young people do not know. The young people do not have the information.
To ensure continuity of the project, I'm going to stay connected to the community to ensure that my fellow youths also get more access to the youth-friendly services that are linked to the community and the facilities.
So we are trying so much to empower these young advocates that we've chosen to speak out on behalf of the entire communities, to equip them with enough knowledge and information so that they will be able to speak for their peers.